les équipes sont toujours de plus en plus réduites, là. Travail à distance.
Oui.
Alors, bonjour tout le monde.
So, hello everyone. We'll do the same thing as in the previous press conferences. The information will be given by Dr. Mylène Drouin from the Public Health of Montreal, first in French, then in English. Then Ms. Julie Grenier, representing the CIUS of the City of Montreal. And then the Mayor of Montreal, Ms. Valérie Plante, who will be speaking in French and English. I would ask anybody listening to us over the phone to please put their phones on mute to avoid any sound feedback. For anybody who wishes to follow this press conference on the web, go on the Santé Montréal Facebook page. Dr. Mylène Drouin.
Bonjour à tous.
So hello everyone and welcome to the regional public health. Today our message is going to have a lot to do with homelessness and support to the community. I'd like to give you some information just to start with. So you heard through the premier that we have 31 official cases in Montreal. However, we have a lot of new cases coming in today. And taking into account this situation, we will have an update as of this afternoon, a more official one, to give you the real count. We still have 2 patients in intensive care. Today, still, most of our patients are just coming back from travel. We have a few family clusters, a few schools concerned, and student residences. One, also cases of gatherings such as marriages, and 1 case in a CHSLD. In the course of the next few days, we will increase the screening volume in Montreal by quite a bit. Already at the COVID clinic, we have doubled since yesterday the number of screening tests, going from 576 to 920. And you will see a very quick progression in the next few days, which will be announced to you. We will also be progressively opening up screening to different groups to really be able to capture cases in the community, so of being able to really slow down this propagation. I would like to reiterate the message that I gave yesterday concerning religious groups of any denomination. It is important to stop gathering. We have had many discussions with different religious leaders of different communities. It is more than necessary, and experience has shown very clearly that in many countries in the world, it is religious groups who were important outbreaks. We have to stop that immediately. For the community area, first of all, I want to say that it's really essential services for the most vulnerable populations. So proximity services to go towards those people. Of course, we are going to maintain their funding during this very difficult period, although we know that the services are clearly going to decrease, and we would like to bring them to concert themselves, group themselves to see how in a neighborhood, starting with the essential needs, how they might maintain an offering of services, a basic one, knowing very well that we won't be able to get every single point of service in communities, but how they can collectively get together to think about a minimal offering for those vulnerable populations. Our public health teams are going to deploy themselves to go meet you in order to identify your needs, but particularly give you the correct guidelines to make sure that you can protect your employees. Thank you.
Hi, everyone. Today in Montreal, as you've seen, as was told by the Prime Minister, we have 31 confirmed cases in Montreal. But since the announcement, we add new cases that are coming in. So this afternoon, the government will do an update on those numbers. We have still 2 persons that are in intensive care unit. Most of our cases are still travelers. We have family groups that are affected by the situation, schools, student housing, one CHSLD, and we had cases in a big event that was a wedding. Over the next few days, we will increase considerably the numbers or the volumes of screening tests in Montreal. Since yesterday, we doubled the number of tests, passing from 570 tests to 920 tests. I gave the message yesterday, but I want to give it today also. The message to the religious group and places of worship. It is very important that you stop right now your gatherings. We've talked to many leaders of your community to help us bring the message to you. And we know, and the experience that we've seen in other countries, religious groups are vectors of transmission, are important vectors of transmission. Please follow the order. Concerning community groups, of course, we know that those groups give essential services to the most vulnerable population in the community. I want to reassure them that the funding will be maintained. In the context of the pandemic, I'm asking these organizations to join together to see how they can keep a minimal base offer of services to the most vulnerable population, because we know we cannot be everywhere. We cannot open all point of services right now, such as senior, food banks, Meals on Wheels. To address your concerns, I will put some teams in place from the public health department to go and meet you to better understand your needs, and to provide you guidelines to make sure that the personnel of your organization are well protected during this pandemic. Thank you.
So, hello, good afternoon. What we are announcing today, concretely, in the present situation, the health network, of course, has to work together with all the other networks who are helping out anybody who are homeless. So as of next week, there will be an adaptation to be able to accompany those people. So an adaptation of the service offering. What does that mean? The unit at Royal Victoria, where people go when there's not enough people, will see themselves transformed in an isolation unit for people who are homeless. And we are still in a situation where our winter measures are in course. The winter is not over, and we cannot allow ourselves to leave more people outside, of course, in the present situation. People who go to those places will be displaced. There will be a new shelter to be able to welcome them without breaking in the service. So as Dr. Drouin was mentioning, we also have to adapt the entire offering of services of these organizations and support them. We wish that anybody who offers services to people who are homeless remain open. We are conscious of the fact that the situation is more difficult right now, so we're working hand in hand with the community network, with the City of Montreal, in order to allow them, first of all, to adapt their services, to follow the guidelines for public health, and if needed, to find solutions, to have activities together, find new places, to be able to really ensure the continuity of services for people who are homeless.
So a few words in English. The course of action for the homeless population. Starting point, in the next few days, we will relocate the overflow shelter, actually located at the shelter at the Royal Victoria. This move is to let the place at the Royal Victoria to make a specific healthcare point of service for the homeless population. The community network is a very important element in support of homeless people throughout this crisis period. The Health and Social Services Network and the City of Montreal are here to support them. Current winter measures are maintained and adapted to the situation. The homeless people which actually go to the Royal Victoria will be relocated without any interruption in the new shelter within the same days that we will open the new services at the Royal Victoria.
Yes, hello to everyone. I am very happy this afternoon to be with my colleagues of the CIUS Centre-Sud de l'île de Montréal, but also the Regional Direction for Public Health, in order to be able to talk about the measures linked to a community that is particularly vulnerable right now, and it is that of the homeless. Everyone has started working very hard in order to find solutions, in order to improve the daily lives of the people who live in the streets and to find solutions as well. We were talking about it with the centers that were identified. I really want to thank all employees, all volunteers who work in the different shelters. They do absolutely exceptional work, very important work, and we know we want to recognize that contribution through the government of Quebec. We made a request so that employees be considered, or that the work that they're doing be considered an essential service, which was accepted. And we're happy about this because it means that those people, the people who work with the homeless population, will be able to use the daycare service set up by the government of Quebec. So I wish to thank the government for their opening. And of course, I'm telling all those workers who are in the field right now to continue with their excellent work. In the elements that are put forward in the City of Montreal, but of course as a support to everything that Ms. Grenier mentioned. For us, it's really important to identify places that could be used to all overflow shelters and units, and to make sure that if we have to decrease the number of people who are present at the shelters, we would have places to be able to house them. And this is now done. The City of Montreal has identified many places up until now, and we will be able to tell you more as the plan deploys. What I also wanted to mention is that the City of Montreal and the Ville-Marie borough has found solutions for everything having to do with the basic hygiene needs for the homeless. And we have decided to deploy sanitary temporary places, which are made of places where they can wash their hands and go to the bathroom, and in other places to make sure that everybody can satisfy their basic needs. So the list of the places where these will be deployed will be communicated very quickly to the different organizations that work with the population who live in the street. We're also working with United Way of the Montreal area to set up different, or to make available different sanitary products such as cleaning products, disinfectant, and wipes. I wish to thank the Greater Montreal United Way for their efforts and contribution, and it's always a pleasure to work with them. Another element, talking about the people who are more vulnerable, I talked about it to you on Friday. It's a question of food banks. We have a lot of employees who are available and who are now helping out at Moisson Montréal, and we're very happy about this. And since the needs remain very important, we'll be able to deploy employees depending on the needs that will be shared. Because in a circumstance such as this one, we can see that the needs are not always the same from one organization to the next, but we are present. So it really is what I wanted to tell you this morning, or rather this afternoon, and of course reiterate the messages of Dr. Drouin, the importance of respecting guidelines, of really ensuring it is essential, in fact, that we not gather anywhere, inside or outside. We invite people to go air themselves out. It's good for your health, but respect the rules. If we're talking about 1 or 2 meters distance, you have to respect that. So yes, you can, well, maybe not enjoy the outdoors so much today because it's raining cats and dogs, but enjoy the outdoors, yes. But I invite you strongly, in fact, I ask you to please respect the guidelines and, of course, to wash your hands assiduously.
I'm going to switch to English now.
English?
I was just beginning by saying that I'm glad to be here with my colleagues to talk about how we are addressing the needs of the most vulnerable in our society. And of course, I'm talking about the homeless community and the announcement that has been made by the CIUS du Centre-Sud de l'île de Montréal et bien sûr de la direction régionale de la santé publique.
The regional direction for public health are going in that sense. Montreal is there to help out. We are happy to know that...
Oh, I switched to... I'm sorry.
I'm sorry, I switched to French, didn't I?
It's Friday. Sorry about that. So, we work together. I guess that's what I was about to say, that it is a collaborative effort. And I'm very glad that of the announcement that were made about the Royal Victoria, of course, and how we can support better this community. Montreal is there to support as well in terms of other physical space, if there's a need on that front. And what we have decided to do today is also to make available some temporary toilets where, well, they will be also equipped with running water. And it will be displaced in different places in Montreal, a lot in the downtown area, and the location of those toilets will be available through the organization that work with the homeless community. Also, I want to thank the Sanitary du Grand Montréal, who is offering hygiene products and material to the homeless community, anything to disinfect and to wash their hands through so different things like that. So as you can see, it's a team effort. I would say the needs are changing, but we're always there to adapt. And just a word around adapting is about everything related to food banks. The needs are there. Vulnerable community are still, they were hungry before and they will continue to be hungry, and there might be even more people in need. So the City of Montreal is still really active through working with their public servants and how they can support those efforts as well. So last thing, but a very important one, I just want to reiterate the importance of what Dr. Drouin have said around gathering, places of worship. It is not the time to gather. It is time to follow the recommendation. It is for your health and the health of the entire society. We need to stop gathering. So please follow the recommendation done by the government of Quebec and also by the Public Health Authority. Thank you very much.
We'll now be going to the question period in French.
Kathleen Lévesque, et par la suite, on va passer aux questions au téléphone. Je rappelle que c'est une question et une relance.
First questions here on the premises and then phone questions. You regularly talk about measures. Screening tests have been increased. We've heard about new modalities. What is it that we can expect? Inaudible. The objective is going to be thousands of tests per day, up to 5,000 tests even per day, and there should be an announcement. We really want to deploy that ideally over the weekend. But I think that it will be announced to you because there's a lot of logistics having to do, you know, when you get to such large volumes. So we really are working out the last details in order to be able to broaden that screening and to be able to get, you know, the clusters, the cases that we're having a hard time detecting right now. And concretely, the tests, what could they be like? It's part of the options that we're looking at, but not all Montrealers have a car. So we want to have a vast service offering. But, you know, there's Saint-Justine has started certain emergency wards, there are clinics, and there will be the west and east that will start as well. But I think that the service offering is going to be evolving and will be announced to you, if not tomorrow, well, at the very least over the next few days. One last question. Since I'm here, Madame Plante, as far as the homeless are concerned, there's the Royal Vic, as Dr. Drouin mentioned, will be available how many homeless people need to be housed at the Royal Vic? I'm going to let Ms. Grenier answer, since it was set up in part by the CIUS. Right now, there's about 170 people who are spending the night at the Royal Vic. These are people, homeless people who choose this place as an overflow shelter. It's, a winter measure. The transition that we've made makes it that these people are still going to have some place to sleep next week when we transform the Royal Victoria Hospital in a specific place for COVID-19 for people homeless. So the 170 people who slept there last night will quite simply spend the night in another place that will be set up for the same needs that the Royal Vic was filling right now. Telephone questions now. I would like to remind all journalists to put their phones on mute except the person answering or asking the question. Inaudible.
Est-ce que, Madame Drouin et Madame Plante, vous avez été rassurée en quelque sorte par la réaction des Montréalais après les demandes d'isolement? Et j'aimerais dire, contrairement à ce qu'on a vu à travers le monde, en Floride, à Los Angeles ou encore à Paris, où d'autres mesures drastiques ont été nécessaires parce que les gens n'écoutaient pas nécessairement ces demandes. Est-ce que vous avez été rassurée?
Right now, with the epidemiological situation that will be evolving in the next few days, clearly we'll have a seat. It's not a decision that is taken locally. This is a decision that has to be coordinated and well thought on the additional measures that will have to be taken for regions such as Montreal, but that could also be for the greater Montreal area. We have to take the time to look at the epidemiological situation, to look at the application of the measures that have been set up, and with those elements we may be able to look at specific measures for a region such as ours, or perhaps other measures that will be applied to Quebec. But it is clearly a measure that we cannot take just as a city. We have to coordinate ourselves because it would have important repercussions, and the application of these extra measures sometimes requires that other ministries join themselves to us to make sure that they are applied. On my end, when we made the decision Thursday last to close down facilities in the City of Montreal, like arenas, cultural centers, pools, the idea was to send a very strong message that the recommendations had to be taken seriously. And up until now, I would tell you that I am satisfied with the collaboration of Montrealers. Now we see that there are still people who are resisting, who perhaps don't feel that this concerns them, and that is why we are sending messages repeatedly. But for everything else, of course, I'm working very closely with the regional health authorities. We're going step by step, but I consider that Montrealers are very disciplined, generally speaking, although we're not letting down our guards. Okay, the question. The first question is for Ms. Drouin. The public health sector of Montreal, do they support the request of the Côte-Saint-Luc Mayor Mitchell Brownstein of placing his municipality under quarantine? As I just mentioned, that kind of decision cannot be made at the local level. It has to be done looking at all the epidemiological data, looking at the present efficacy of the measures being applied, and looking at the following measures using what we know from other countries. That is a decision that has to be made with the government, and it is possible that there are decisions that are going to be specific to Montreal because of our specific urban context. But in that case, it will be a concerted decision. We'll work on it with the government and also other ministries where we need a contribution to make sure that it is respected. I just wish to reiterate what Dr. Drouin said. Is it possible to know how many people have tested positive and or have been put in isolation since the wedding of the 14th of March? where apparently a person would have contracted the illness. I don't have any specific data on the number of people in isolation, but I do know that there are 2 cases associated to that specific event. And of course, the wedding had hundreds of people present from whom we've asked to be that they be put in isolation. So it has the scope has broadened. I don't have the exact number, but there were, yes, hundreds of people who were participating in that event. Any French questions left on the phone? English questions now.
Est-ce qu'il y a une question en anglais d'autres journalistes qui sont présents sur le téléphone? Bonjour, Aaron.
Yes, Dr. Drouin, given the rapidly evolving nature of this virus, what can you say in terms of Montreal community transmission? We still do not have it, or are we now on the verge of having community transmission?
I think we expected an increase in the number of cases in the next days, and that is what we're seeing. And of course, we're seeing cases that are not linked to travelers and transmissions that are secondary transmission. But at this time we cannot say that we have a sustained community transmission, but we're expecting it.
Aaron, as-tu une autre question?
Second question for Dr. Drouin still. You've asked of you already in French, why are you not necessarily in favor of a quarantine for Côte-Saint-Luc at this point in time?
Because it is a provincial responsibility. I don't say that we're not going to put new measures for Montreal and that we should not, but I think at this time we cannot take those decisions without having a public health analysis, the data and the efficiency of the measures that we have put in place. I think when we take those kind of decisions, we have to be with the government and with other ministry to make sure that when it's going to be applied, we think about all the collateral effects of those measures.
Il reste d'autres questions en anglais sur la ligne téléphonique?
Are there any questions left in English on the phone?
Alors, Carole Rivera de Radio-Canada, je veux juste revenir sur la situation à la ville de Côte-Saint-Luc. Est-ce que ça vous inquiète?
Coming back to the Côte-Saint-Luc situation, are you worried with what has happened over there? Well, right now, the information that we have and, of course, the elements that we have are linked to a community of family, so we still have the capacity to contain things. Of course, what I've heard is that the application of the gathering measures of not getting together, of limiting contacts and doing more social distancing, what I've heard is that perhaps it was not well applied. That is what we're told, and that is why at this stage I believe that we have to remind everyone of the importance that places of worship be closed, that there is social distancing. Do not go get your nails done if it's not essential. Do not go get your hair done. Do not go to the mall if it's not essential to go. So it really is those measures. And I'm not saying that we're not going to get to new measures in the next few days or few weeks, but once we announce them, it'll be because we'll have made a full analysis of the epidemiological situation and of the measures that we have to adopt with the government of Quebec. So if I understand correctly, everyone is being asked on a voluntary basis to do things correctly, and if it doesn't work, then you might adopt new measures. Together with the provincial government, yes, these right now, the provincial measures, the emergency measures are, provincial from the Director of Public Health. These are not decisions that can be taken at a regional or local level. It has to be a coordinated effort. And of course, it has to be done in complementarity with the government of Quebec. Of course, as a regional authority, we will be told and we'll make sure of the application and all the consequences that will be associated to it. if it gets to that.
Olivia O'Malley.
On va y aller avec Olivia O'Malley. Allez-y.
J'ai pas compris qui.
Madame O'Malley, vous pouvez y aller.
Allez-y, pardon.
Sorry. Good afternoon. I was wondering, so the Royal Vic, it will be a housing unit basically for all homeless people who test positive, whether their symptoms are mild or need to be hospitalized?
J'ai pas tout à fait bien entendu la question.
I didn't understand the question quite well, but if I could answer,
That's the question. The Royal Victoria, the mission of the Royal Victoria will be transformed to put in isolation some homeless people who would be diagnosed.
Or waiting for their tests.
Yeah.
Like if you have a homeless people that has symptoms and that has passed the test, while waiting for his result, the homeless person is going to be isolated. And if we have positive cases, it is going to be the place where they're going to be for the time they have to be isolated if they don't need to be hospitalized.
And this measure is put in place to help the other community organizations to not to have to take those people in their shelter while they are waiting for the results or if they are infected, to avoid other transmission.
Okay.
Obviously.
Prochaine question.
I have one.
Oh, go ahead, sorry.
On s'excuse,
Sorry.
c'est très difficile.
And I'm sorry, I know you answered it in French, but I was wondering if you could talk about where you will be putting the people who are currently in the Royal Vic winter overflow shelter when a possible case comes in who needs to be self-isolated.
Okay. The people who are actually in the Royal Victoria as a measure for the winter time will be transferred to another location when the Royal Victoria will transform its mission for COVID-19. So in the same days, we got to switch the mission and open the new place for the people that are healthy but homeless, looking for a place for the night, and the people that are diagnosed with or waiting for a diagnostic of COVID-19 will be now at the Royal Victoria.
Anyone who have access to a bed right now will have access to a bed after we switch the vocation of the
Yes.
Royal Vic.
Same access will be maintained for all the homeless people, but we are adding some specific measures for them within the context of the COVID-19.
Prochaine question.
So, Andrew Brennan, ICTV News. This question for both Dr. Delaine and also the member that has. I guess the first thing is the Quebec Hotel Association has confirmed that they've been speaking with the government about the possibility of using hotel rooms as additional beds for COVID-19 patients that would be less severe cases. I wanted to see just in terms of looking at this possibility, if this is on a public health level a good idea in order to just for their for isolation of patients that are in a less severe kind of developing less severe symptoms and don't need to be in hospitals. If this will if this keeps the health network free or frees up beds in hospitals to ensure that patients that do need to be there can be there.
It is a possibility. The Canadian Public Health Agency and all the quarantine agents, they have already some spaces in some hotels to isolate some patients. So this is something that is currently going on, and we're looking at different possibilities while isolating some person that cannot be at home, or we do not want them necessarily in hospital. Specific cases, we could use hotels, but of course we have to negotiate and see what are the measures that we put in place to make sure that we assure protections of people who work there or who use the services of those hotels. But it's something that we see in different countries, and we do not exclude it.
Prochaine question.
Is it possible to do a quick follow-up? Is that okay?
Oui, allez-y.
Just in terms of the possibilities there, you are saying looking at trying to negotiate about certain if other guests are staying there. Is there any question about things wouldn't be a question of maybe some floors or some hotels being devoted. Would that be how things are being looked at, or would it be a question of ensuring that common spaces, elevators, and things like that are being properly sanitized so that they can be used by the general population or whoever is there to be using these hotels?
At this time, we're more. It is a little bit early to tell what we're going to be doing, but we're looking at all those questions. If it's one hotel, if it's a floor, if it's with mixed population. But at this time, we're quite early in the process to announce anything.
On prendrait une dernière question au téléphone.
I have a question.
Pardon, allez-y. À qui la parole?
C'est Michel Sabat, la presse canadienne. Je peux poser deux petites questions. Là. D'abord, il y a été question...
There was a question twice during the press conference in your message to religious groups. Could you describe to us why the message, the indications that the message is not being heard? Well, there are many people, even public services, who have indicated to us that still, and it's, it's many religious groups, I'm not talking about only one, but they are still gathering in certain communities. It comes from population or public services. So, of course, for us at this moment, before getting to coercive measures, we really are asking religious leaders to insist that these measures, these gatherings stop immediately, since we know that really religious groups have been very important vectors of transmission of the virus in other countries, and we really wish to avoid that as much as possible. And if you allow me, for the past few days already, the City of Montreal has been communicating with different communities. I do wish to remind you that the churches are closed. We talked about the Council of Imams of Quebec. The Hasidic Jew community decided to close down the synagogues. So there's good cooperation, good collaboration, but we still see exceptions and people who are recalcitrant who still decide to have gatherings, regardless of the faith here. So it really is very important. That is why we are repeating that message, because everybody has to feel concerned. And of course, we are going with dialogue to talk about the spiritual leaders of the different communities to, on the one hand, prevent gatherings, but also to send the message to their communities, the importance of following those rules for reasons of public health. So that is education, and we're going to continue doing that. How exactly do you plan on isolating the homeless at the Royal Vic? Are they each going to have a room? How's that going to happen? And up to how many people can you house? I don't know what the maximum capacity is. Well, the situation, such as it is right now, is going to evolve. And of course, first and foremost, they are going to open with 50 spots, but that will continue evolving. They have the ability to get 100 and 150. They'll do whatever is necessary in order to be able to have the people that they will have. Of course, that will be done in a context that will respect all the measures that have to be taken in the situation of people who are infected. So, of course, yes, individual rooms, and depending on all the recommendations of public health that are associated to the setup of isolation for anybody affected. So it's a specific place for these people because, of course, we cannot put them in isolation at home. They are homeless. One last question.
I'll start with the mayor and Dr. Dwight. Cour Saint-Luc, specifically, I know it was asked in French, but the mayor there did express concern that maybe his city is becoming a bit of an epicenter for this virus because of the concentration of seniors, the number of snowbirds, and the concentration of places of worship. What level of concern do you have when it comes to what he said, that it could become a bit of an epicenter for this virus?
I do understand the concern that he has, because he has a concentration of group at risk and communities, some cases in community where there was gatherings. At this time, what I said, and I know that we're going to take some measures in a couple of days to look at the epidemiological situation for the entire island of Montreal and to see if there's some sectors or some measures that we have to take. But those cannot be taken at a local level. We have to make sure that we are aligned with the government and other ministry that will help us apply those measures.
Well, I mean, for people who are not familiar, Côte-Saint-Luc is right in the middle of Montreal, so it's surrounded by different boroughs. So I think that when Dr. Drouin said that it cannot be just a local initiative or an actions, because we're all connected in this. So I understand the mayor's concern, of course, and I think he definitely want to do the right thing. But for me, it's very important to follow the directive and to be connected to the work of the government of Quebec, but mostly the Regional Authority of Public Health. So I would definitely go with what Dr. Drouin have been saying about that.
And just a quick follow-up for Dr. Drouin, a bit of clarity on the people who are getting tested. Who's getting called back? Because it seems like the Minister of Health said right now it's only the positive, people that test positive that are being called back. Can you shed some light on that? Is who's being called back and why wouldn't people get a call to say, oh, no, you're not positive?
Usually it's the responsibility of the doctor that made the prescription to give the test back. I will verify why the tests are not given back, the negative test, but usually we have the result in 24 to maximum 48 hours after the tests have been done. So usually if someone is positive, they should know, and those are our priority. And what we have really mobilized enormous lots of resources to do the screening, to do the investigation, and calling back every test with the numbers we're going to do this weekend. It's impossible, and we would have to have new resources mobilized only to give back the test. So maybe it's going to be the direction that we're going to say that if you're not called back in a certain length of time, it's that you're negative. But I don't think we're going to have the resources to call everyone back.
So people should assume that there's a certain time lapse that, okay, maybe I'm fine.
Yeah, but I can verify, but I think this would be the way, I think the way it is managed actually.
Would you allow me one last question? Dr. Drouin, what concern do you have that we're hearing more cases of healthcare workers who are testing positive as far as their safety, but also other patients in those establishments?
I think what we'll see is the screening of healthcare workers with symptoms are going to be a priority coming soon, because we have to make sure to protect our healthcare workers. I always say if we do not protect them, we'll have problems in 2 or 3 weeks to go. And of course, we're reinforcing all the measures in the hospital to make sure that the protections are there, the equipments are there, because it's central. We have to protect our healthcare force.
Merci beaucoup tout le monde.
Thank you.
Thank you, everyone.